This is CGTN, China Global Television Network.
Wuhan Milestone, city where the first coronavirus case was confirmed, reopens after 76 days under lockdown. Lessons from the Ebola outbreak. Find out how the DRC is learning from its past to stop the spread of COVID-19. And the coronavirus pandemic raises food security fears in Zimbabwe. Hello and welcome to Africa Live on CGTN with me, Beatrice Marshall, in Nairobi. We'll bring you the details on those stories in just a moment, but first, Uche Okoronkwo with the day's business headlines. Uche.
Thank you, Beatrice. And here's a look at what's coming up on Africa Live Biz. South Africa's business confidence is now at its lowest level in 3 decades. And the World Bank releases $82 million to support Nigeria's COVID-19 response. Of course, more on that are coming up within the program. For now, it's back to you, Beatrice.
Uche, thank you. And we begin with the latest on the COVID-19 pandemic. Globally, there are now more than 1.4 million confirmed cases. 83,000 people have died. Cases in the U.S. have surged to almost 400,000, over a quarter of the global total. American hospitals reported nearly 2,000 deaths on Tuesday, a daily record. More than half of all cases are in Europe, with Spain and Italy the hardest hit there. In the Middle East, Iran has registered 64,000 infections. The Chinese mainland reported 62 new infections, including 3 local transmissions and 59 people returning from overseas. Now, after 76 days in lockdown, transport links to and from the city of Wuhan are open again. The easing of travel restrictions comes with a drop in new cases across China. Barricades were removed at toll gates around Wuhan at midnight on Tuesday. At least 55,000 people are expected to travel out of the city by train. But officials warn that lifting the travel ban does not signify an end to pandemic control measures. Ji Yunfei has the latest.
And though the lockdown has been lifted on Wuhan, prevention and control measures in communities are still in place. On Tuesday, the local authorities called on all residents in Wuhan not going out of their neighborhood, the city or the Hubei province if it's unnecessary. People should avoid gatherings and masks should still be put on in public places. This morning, I went to Bulletin community, one of the most iconic places in Wuhan's fight against the virus in the early stage of the outbreak, and also the first place I visited since I came to the city 2 months ago. Compared to last time I went there, there were more pedestrians on the streets and much more traffic on the roads. Taxis were back on the roads, and banks also reopened for the first time in the past 11 weeks. And I noticed that many elderly people are queuing in front of banks, but community workers are still safeguarding the gates to minimize the traffic in and out of the communities. And many barricades and wires are still in place to block most of the entrances and exits. Only those people who have real demand to purchase life necessities with a work certificate or a green card on their phones to prove their health can have access to the outside world. So in the city, the alarm level hasn't been lowered. One of the major reasons is, according to the authorities, there are still many asymptomatic COVID-19 carriers, which means people infected with the virus but not showing any major symptoms in the city.
The top leaders of the Communist Party of China have met to discuss epidemic control and work resumption. General Secretary Xi Jinping chaired the meeting of the Politburo Standing Committee. He said China's containment measures have been effective and need to continue. He said the coronavirus is spreading around the globe, creating uncertainty and endangering global economic growth. He said China needs to be well prepared to deal with long-term challenges to the health system and the economy. Xi Jinping said Hubei province needs to focus on better treatment of severe cases, and authorities must stop local transmission of the virus from people returning from abroad. He stressed the need to support small and medium-sized enterprises and an orderly resumption of business activities. And he emphasized the need to stabilize market supplies and prices. Well, the restrictions on movement in and out of Wuhan and within the city have been lifted, and people will be able to transit through Wuhan and all of Hubei province. But how will the worst-hit city avoid a resurgence of the virus and another potential outbreak?
Wuhan, where the outbreak of COVID-19 were first reported in China, has ended its unprecedented lockdown. The restrictions on movement in and out of and within the city have been lifted, and people will be able to transit through Wuhan and the whole province. But what should this worst-hit city do to avoid a resurgence of the virus and prevent the second potential outbreak? But if you put this question to scientists, the answer may be very simple, or at least sound simple. Keep face mask on and practice physical distancing. But how far do these measures need to be taken in order to prevent a second outbreak? That's what a joint research team from China and Australia have been trying to figure out. Using a mathematical model called SEIT, they examined 6 days for potentially lifting the quarantine from the end of March to the end of April. Of course, the longer the lockdown was kept in place, the better the epidemic could be contained. According to their calculation, if Wuhan had remained in lockdown until the 25th of April and there is no important cases, the curve of epidemic would have seen a smooth decline without any chance of a rebound. But from an economic perspective, that was ruled out. Based on China's current per capita GDP, every day of lockdown in Wuhan, a city of 10 million inhabitants, means the direct economic loss of about $280 million. If the lockdown had been lifted at the beginning of April and social life had gone back to exactly how it was before, the team say we would have needed about 80% of people to keep wearing masks to maintain the hard-won control of the epidemic. What's more, if 80% of people kept on wearing masks, even lifting the lockdown at the end of March wouldn't have caused a rebound. But bringing about an end to the epidemic would have taken more time. If, however, the percentage of the face mask usage dropped to somewhere below 70%, researchers predict a second major outbreak. The research team gives us the predicted curve with just 50% of face mask usage, where we can see a clear rebound in case numbers because of people who show no symptoms. They say after 200 days, we would be back with a bigger outbreak than we saw between February and March. The study also shows more public interactions, such as the influx of returning residents to Wuhan may demand a higher level of face mask usage if it's not to trigger a second outbreak. When there is 50% more interaction among people than before the lockdown, 80% of mask usage will be too low to prevent a second outbreak. But that's all math modeling. In reality, even after the lockdown has been removed, social activities cannot get back to 100% that fast, as many strict controls are still in place, and people will remain cautious for a long time. And all of those things will be helpful.
Now, a UK-based data provider says China is leading the world in COVID-19 research with the highest number of clinical studies underway. The Coronavirus Research Index by Finbold has identified nearly 300 active projects in 39 countries and regions, all of which have confirmed cases. Finbold says the data will be updated on a weekly basis. Meanwhile, the US-based clinicaltrials.gov has identified 60 ongoing studies in China, followed by 49 in the United States. Let's now turn to Africa, where over 10,000 cases of COVID-19 have been confirmed. 52 countries have reported coronavirus cases. The death toll on the continent currently stands at 535. Data from the Africa Centers for Diseases and Prevention also shows over 1,000 people have recovered from COVID-19 on the continent. Meanwhile, Ethiopia has declared a state of emergency in response to the coronavirus pandemic. Prime Minister Abiy Ahmed has called upon Ethiopians to stand with the government in overcoming the crisis. Authorities have already taken a series of measures, including school closures, bans on public gatherings, and work-from-home directives for most employees. Africa's second most populous nation has recorded over 50 cases of COVID-19 and 2 deaths. Elsewhere, the East African regional body, the Intergovernmental Authority on Development, or IGAD, has donated $100,000 to South Sudan to support the country's efforts to prevent the spread of coronavirus. South Sudan on Monday confirmed a second case of COVID-19. CGTN's Patrick Oyet reports.
The donation is from the staff of IGAD to support measures to stop the spread of coronavirus.
We believe that the pandemic will go out soon. We are very much happy to do so, and at the same time I would like to inform you how much we are pleased with all activities in order to fight the pandemic in this country.
One of the biggest challenges in South Sudan is the underdeveloped health sector. South Sudan's population is about 11 million people. The government says the country has only 4 ventilators, a key equipment in the treatment of patients with coronavirus.
We have appealed to our partners internally here. We have also appealed to IGAD. We have also appealed to the international community to help South Sudan in combating this virus.
However, each of the international donors is now also battling the same virus in their own country. South Sudan's government has imposed a partial lockdown, curfew, suspended international flights as measures to prevent the spread of coronavirus, and now says the donation from IGAD would be used to raise awareness on COVID-19. Patrick Oyet, CGTN, Juba, South Sudan.
Now, with the help of 3D printing technology, a South African university is helping fight COVID-19. A team at the University of Pretoria is using a 3D printer to make visa frames. The visors will be used by healthcare workers testing and treating COVID-19 patients. The country has the highest number of confirmed cases in Africa. So far, 1,749 cases have been confirmed. The government has rolled out measures like a 21-day lockdown and a mass testing program to stop the spread of the coronavirus. As hospitals continue to care for patients, the University of Pretoria hopes their 3D printed face shields can help keep them safe.
3D printers allows us to act quickly to this demand. It's rapid prototyping, so it's not mass manufacturing, but with 3D printers we have the ability to react to this call. And I think we need to give our healthcare workers all the help they can get. So there is a shortage of masks and visors or personal protection equipment in the country. So we thought, we'd give them a fighting chance as well by providing this.
In the Democratic Republic of Congo, health experts say the end of the Ebola outbreak there could be declared this month, but only if no new cases are recorded. The epicenter of the outbreak has gone for 49 days without registering any new cases. Experts say the country could use lessons learned in the fight against Ebola to stop the spread of the coronavirus.
The DRC's worst Ebola outbreak is nearing its end. No new confirmed case has been recorded since February 17th. The outbreak can only be declared as finished after 42 days have passed without any new infection. The World Health Organization says it could declare the outbreak over on the 12th of this month if no case is reported in eastern DRC. But the country is now struggling to contain the spread of the coronavirus. The head of the DRC's Ebola task force says the gains made couldn't have been made possible without the support of the communities.
Cette victoire sera également
That victory was the result of the cooperation that we had with the Congolese communities, especially in those areas affected by the disease.
Health workers faced a lot of resistance from community members at the onset of the outbreak. They also lost some of their colleagues in attacks by militia groups. The DRC is now using the lessons learned in dealing with the Ebola outbreak to tackle the coronavirus.
It will be impossible for us to win the fight against COVID-19 without working closely with the communities, just like we did during the Ebola outbreak.
The Ebola outbreak claimed more than 2,200 people in the DRC since it was first reported in August 2018. The containment of the Ebola outbreak required a broad response from medical experts, the government, and the locals. The international community also played an important role by funding the response effort. But the DRC government now has to strengthen its healthcare system, which has been underfunded for decades. Chris Sochamringa, CGTN, Kinshasa, Democratic Republic of Congo.
The World Health Organization officials have denied that the body was China-centric and said that the acute phase of a pandemic was not the time to cut funding. The World Health Organization was responding to U.S. President Donald Trump's remarks that he would put contributions on hold. Trump made the comments at a White House press briefing. He criticized the World Health Organization, saying, and I quote, "They missed the call on the pandemic." But when challenged on whether it was the right time to make such comments, President Trump told reporters he was only looking at the prospect of withholding of funding. Well, for more on that story, I'm now joined by Julia Lyubova, who's live for us in Geneva. Julia, thank you for joining us on the program. To start off, tell us more about the World Health Organization's response to remarks by President Trump.
That's right. The head of the World Health Organization had responded to Donald Trump's criticism and threats to cut the funding of the organization. Dr. Tedros actually spoke at his daily briefing, and he said that coronavirus is a common enemy, and it's very dangerous, and it's a common enemy for all the countries around the world. He said that leaders should not be politicizing this coronavirus. He called the leaders to quarantine politicizing this coronavirus. He said that leaders and countries need to behave to beat this pandemic. And he said that if leaders don't want any more body bags, then they should refrain from politics. So that was the very clear message from the head of the World Health Organization, to stop politicizing this coronavirus. At the same time, Dr. Tedros had called for the US and China to join together to fight this virus. He said it's critical for national unity, it's critical time for global unity and for countries to work across any of the differences. And the focus should be on saving lives. And indeed, he said that using politics is playing with fire.
Well, the World Health Organization partly depends on governments to fund its operations. What would be the consequences of U.S. withholding of funds during this pandemic?
That's right. So the United States is actually the largest contributor to the funding of the World Health Organization. Last year, for example, the US had contributed just under 15% of the total funds of the World Health Organization. But at the same time, according to figures provided in March this year, the United States has almost $100 million in outstanding payments to the World Health Organization. At the same time, the organization says that it has so far received or has been pledged $800 million to fight the pandemic. And it says, of course, that it uses these funds to work day and night. It's a global network of experts, keeping the world informed, and of course providing support to all the nations. For example, it says that more than 1 million tests for COVID-19 have been sent to 126 countries already. But it says that that's, of course, more help is needed more than ever. And of course, it says that it is grateful to the United States for its support, but it says that more must be done to continue to fight this pandemic.
All right, Julia Lyubova joining us there from Geneva. Thank you. You're watching Africa Live. Still ahead on the program. The coronavirus pandemic raises food security fears in Zimbabwe. And while under a coronavirus lockdown, Rwandans remember genocide from home.
You don't find the stories of North Africa by sitting on the sidelines. You've got to get out, go there, and you'll find them. In the bazaars of Casablanca, among the crowds in Cairo,
who come to visit Cairo, the ancient capital of Egypt.
Along the waters of the Nile, along the sands of the Sahara. No one else will take you where we can in North Africa. No one else will show you what it's all about. CGTN, see the difference.
Zimbabwe is among 18 nations that will be left worse off after the coronavirus pandemic, according to the United Nations World Food Programme. WFP says the drought-stricken country now needs donor aid more than ever before. CGTN's Farai Mwakutuya tells us more.
62-year-old Faisa Savanu lives off paltry earnings from collecting used plastic bottles and growing whatever she can in her garden. She's unwell and has back problems, which affects her ability to do both effectively. Because she's below 65 years of age, she does not qualify to receive food aid from the government. She literally has to scrape by to feed herself and 2 grandchildren.
We can't afford to eat in the morning, afternoon, and evening. Most of the time, my grandchildren will eat before they go to school, and that's all until supper. They don't carry anything to school for lunch either.
Across the road lives Jenny Pararadza. She's among millions of beneficiaries of a social welfare food aid scheme, under which she used to receive 50 kilograms of maize each month, which has now been replaced by a cash payout.
The $180 I received can't meet my food requirements. The price of maize meal and all other commodities have gone up. Last month, I managed to buy just 1 bottle of cooking oil and a bar of soap.
That's left her and 5 grandchildren in an extremely difficult position.
During the last season, we harvested 1.5 buckets of maize, which won't go very far. We are already not eating properly, so this will just make life tougher.
The elderly neighbors live in Hopley, an informal settlement on the outskirts of Harare. Many of the residents here live in poverty.
Already in dire straits, the economic fallout from the coronavirus pandemic will leave this community in an even more vulnerable state.
The government has launched a $2.2 billion appeal to help it respond to COVID-19, a target that may be hard to reach given that as at February, the World Food Programme had still not raised the funds needed to feed 4.1 million food-insecure Zimbabweans. Farai Mwakutuya, CGTN, Harare, Zimbabwe.
As Rwanda marks the 26th anniversary of the 1994 genocide, grieving families will not be able to gather together as the country is under a lockdown. Television and radio stations are playing songs and programs to remember the victims. CGTN's Daniel Arapmoy with the details.
Rwanda's 1994 genocide claimed about 800,000 lives. And every year, families of the bereaved gather around a memorial site to grieve their loved ones. But as Rwanda marks the 100 days of the genocide this year, the government has banned social gatherings and imposed a lockdown in an effort to curb the further spread of COVID-19.
The genocide survivors decided that they would follow 3 fundamental principles. The principles are to constantly work on remembering what happened, whether it's raining, snowy or sunny, or in the face of obstacles. These are the principles that are in the Rwandan constitution.
The coronavirus pandemic has spread throughout Eastern Africa, with the region confirming over 500 cases. Last month, Rwanda closed its borders as part of a broader lockdown designed to curb its spread. President Paul Kagame has said that Rwanda has to remember the genocide despite the coronavirus outbreak. He laid a wreath and lit the flame of hope at the Gisozi Memorial Site, where more than 250,000 people were buried. Many Tutsis and Hutus were killed in the violence. To date, many of the victims are still traumatized about the merciless killings.
Sur le plan psychologique.
On the psychological level, there are those who will relieve traumatic experiences during this specific period. We have taken measures to try to contain this problem by working with medical experts. We, the Ebola Foundation, have also contributed by training psychologists and mental health experts.
La structure médicale.
With families under lockdown, radio stations and television channels in Rwanda are airing programs and songs that remember the genocide victims. Daniel Arap Moy, CGTN.
And here in Kenya, experts warn that a second wave of desert locusts will soon ravage farms across the country. The swarms are estimated to be about 400 times bigger by June if successive generations are not eliminated. The new swarms are expected to hatch in May. Here in Kenya, more than 20 countries have been infested by the pests. Counties, I beg your pardon, have been infested by the pests. Here's a look at how Turkana County has been affected by the locusts. Let's now go to Uche Okoronkwo for the latest in business news. Uche.
Thanks, Beatrice. And coming up on Africa Live Biz. South Africa's business confidence is now at its lowest in 3 decades. And the World Bank releases $82 million to support Nigeria's COVID-19 response.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Africa Live. Find your voice.
Well, let's start off in South Africa. The country's business confidence retreated to a 3-decade low in March. This as the ramifications of the spread of the coronavirus became more apparent. Now, the South Africa Chamber of Commerce and Industry Business Confidence Index fell to 89.9 points in March from 92.7 in February. The exceptional negative monthly impacts came from lower new vehicle sales, a weaker rand exchange rate against the major currencies, and dropping share prices. Now, the BCI comes as SA is in the grip of a 21-day lockdown in order to slow the spread of the coronavirus. But the lockdown has caused a near complete halt of business activity, apart from essential services. The South Africa Reserve Bank is forecasting an economic contraction of between 2% and 4% this year. The bank also estimates that this could wipe out 370,000 jobs, as about 1,600 businesses continue to shut their doors. And heading to Kenya now, the country's economic growth will slow to 3% or less this year from an earlier forecast of about 6%, and that's due to the effects of the novel coronavirus. The Finance Ministry had earlier given a 6.1% growth forecast for 2020. Meanwhile, the proposed income and corporate tax cuts aimed at shielding the economy will cost the Kenya Revenue Authority about $12.2 million daily over the next 3 months. Now, the Parliamentary Budget Office, which is the unit which advises lawmakers on financial, budgetary and economic matters, said that revenue collection will drop by $1.1 billion. Now, the drop is expected between April and June if lawmakers adopt these tax cuts. Parliament was to convene on Wednesday to debate the proposals, but the debate had been put off over coronavirus fears. And Uganda's central bank has slashed its policy rate by 100 basis points to 8%. That is the lowest level in nearly a decade. The bank's Monetary Policy Committee says the COVID-19 pandemic and the policy responses to it have now triggered a severe contraction in economic activity. While CGTN's Michael Baleke filed this report from Kampala.
The Bank of Uganda says the economy is expected to slow down drastically in the second half of this year. The growth projections are between 3 and 4% compared to earlier estimates of 5 and 6%. According to the central bank, the coronavirus has heightened uncertainty, and its measures like social distancing have severely affected consumer demand. The manufacturing sector too has declined on account of disruptions to the inflow of raw materials, and easing the key benchmark lending rate is expected to lessen the COVID-19 pressure on the economy.
The central bank action yesterday to reduce the CBR was the necessary step that needed to be taken, especially at this stage as the economy really struggles to deal with this COVID-19. When you look at the global response, most central banks in the world have come up en masse to come up with measures to sort of cushion their economies. So Bank of Uganda is following suit.
The central bank has also directed commercial banks to restructure loan payments for their customers following the difficult business environment created by COVID-19. The monetary policy statement signed by the bank governor also notes that assistance will be given to commercial banks that are in distress for a period of up to 1 year.
The challenge most economies, including Uganda, that they are facing is how do you ensure that the financial system functions smoothly.
However, while there is significant uncertainty over the depth and the duration of the current slowdown, the Bank of Uganda is hopeful the economy will gradually recover in the second half of 2021. Michael Baleke, CGTN, Kampala, Uganda.
Now, the World Bank has set aside $82 million to support Nigeria's fight against the COVID-19 pandemic. The bank says it is moving with haste to provide fast and flexible support in order to help Nigeria and other African nations in mitigating the impact of the coronavirus pandemic. Now, the bank is also providing direct and long-term financial support over the next 15 months. The lender has been requested to provide a multi-pronged package of support over the next 6 months. This, of course, will help strengthen the country's preparedness for the immediate health crisis. It will also provide the government with a budget support for a pro-poor stimulus package and the long-term recovery. Meanwhile, the IMF is also working on Nigeria's request for a $3.4 billion COVID-19 facility request. Now, oil prices bounced back on Wednesday. Brent crude was up by 75 cents or 2.4%, while West Texas Intermediate rose $1.30 at 1.5%. Now, the recovery was lifted by hopes that Thursday's video conference between OPEC and its allies will trigger output cuts to shore up prices. OPEC Plus producers say they will agree to curb their output only if the United States and, of course, several others join in the move. However, the the White House insisted that it wouldn't intervene in the private markets as U.S. output is already falling without government action. Analysts are saying uncertainties remain over Washington's involvement in any production curbs. And across the world, countries are feeling the economic impact of the COVID-19 pandemic. In Egypt, the government has had to take measures to curb the spread of the coronavirus. Now, these measures include a night curfew as well as closing hotels and tourist sites. Informal workers, who account for nearly 2 out of 3 job holders, have been feeling the economic impact of these restrictions. Here's CGTN's Asta Tal with more.
For 2 weeks, Yasser has been sitting under this bridge, waiting for work. He earns his daily wages as a casual day laborer. But as COVID-19 spreads across Egypt, there are fewer jobs available for him.
Our health depends on our source of income, and our health is our source of capital. If we work, we eat. If we don't work, we don't. This lockdown is correct, yes, but only if we were full-time laborers. We wouldn't have to leave our homes because we would get paid at the end of the month. But where is my salary? I have electricity, water bills, and rent to pay. Here in Cairo and back at my home in the countryside. This coronavirus has turned our lives upside down.
Egyptian President Abdel Fattah el-Sisi approved a $6 billion plan to help cover for the economic fallout. The plan includes paying informal workers 500 Egyptian pounds, or around $31 a month. The payments will happen for a 3-month period. The country's tourism industry has also been hit hard by the pandemic. The government's closed hotels and tourist locations to curb the spread of COVID-19.
I have 4 children. This whole coronavirus has completely destroyed the tourism sector. The tourism industry is the first thing that gets affected and the last thing that recovers. In order for us to get tourists back, that will take a while. We have lived through the revolution phase and have gone through other periods of hardship, but we've never seen anything like the impact of the coronavirus.
Egypt has a workforce of around 30 million workers. So far, around 1.5 million people have registered for government assistance. Asta Tal, CGTN.
Now, Nigeria plans to spend $1.39 billion to strengthen its healthcare infrastructure, and that's part of its wider funding to tackle the coronavirus pandemic. Africa's biggest economy has so far confirmed over 200 COVID-19 cases, and it has recorded about 5 deaths. From Lagos, here's CGTN's Deji Badmus with more.
The government calls the initiative the COVID-19 Crisis Intervention Fund. And beyond strengthening Nigeria's healthcare infrastructure, it says part of the funds will also be used to support state governments in their own fight against the COVID-19 pandemic and create special jobs for about 774,000 persons across the country.
The establishment of this fund will evolve and provide the much needed cash resources from various special accounts already existing in the Federation. And this is a process that we will be doing together with the National Assembly.
With over 220 confirmed cases of COVID-19, there were fears that a massive outbreak of the disease in Nigeria would overwhelm the country's fragile health infrastructure. It's the reason why government is moving fast to ensure that doesn't happen. Already, 15 of the country's 26 states, including the federal capital Abuja, have recorded confirmed cases, and health infrastructure in most of the states are very poor.
Lagos State has already been provided with 10 billion naira in emergency funding. As the situation in the FCT and other states of the Federation evolve, the NCDC and the Federal Ministry of Health will make a determination and recommend funding support for any other state that has a critical need.
Lagos is the epicenter of the COVID-19 outbreak in Nigeria, but it also represents the country's best chance of winning the battle against the disease. The city has the highest number of confirmed cases in Nigeria, but it also has the highest recovery and discharge rate as well. And health authorities are upbeat the city would win the battle.
This was the original trend of last week, and the red line is the trend of this week, demonstrating that we've been able to flatten the slope of the curve. If we carry on with this strategy, we will indeed see a flattened curve and an improved capacity of the state and of its infrastructure to manage this outbreak without too many casualties or fatalities.
With funding support from the federal government, corporates and wealthy individuals, Lagos is rapidly ramping up on its facilities to deal with the disease. Isolation and treatment centers are springing up fast, just as testing capacity is also been scaled up. The city has recorded 2 deaths from COVID-19 so far. It's been effectively on lockdown for over 2 weeks now. If Lagos is able to wade through this period without much casualty, then Nigeria would be on the road to recovering from a virus which has crippled economic activities and social life in the country. Deji Badmos, CGTN, Lagos, Nigeria.
Well, that's all for now on Africa Live Biz. But ahead on Global Business Africa, we'll tell you more about why Nigeria has made the decision to shut down its oil refineries. Of course, all that coming up at top of the hour. For now, back to you, Beatrice.
Uche, thank you. And we still have more news for you here on the program. Here's what's ahead. We'll take you to Tanzania, where we'll show you how using body painting to create COVID-19 awareness.
The greatest journeys, the greatest sights, the greatest adventures.
Here in Panata, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
To bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
Africa Live. Find your voice.
As cases of the coronavirus increase in Tanzania, artists are responding to the COVID-19 challenge in different ways. Alex Kalemela is a 22-year-old artist based in Dar es Salaam who uses body painting to create awareness. Here's CGTN's Daniel Kijo.
Alex Kalemela uses his body as a canvas for his art. Being a body paint artist, he can become both terrifying or something beautiful. He has used his art in promotions and concerts for Tanzania's biggest stars. But since the spread of the coronavirus, he created a character who goes around Dar es Salaam city and educates people on how to protect themselves from COVID-19.
How can we shock people into realizing this is a big threat? I use the Joker image to say, just as you fear the Joker, you should fear this virus. It's 100 times worse.
Alex believes that art can simplify COVID protection messages and motivate people to turn thinking into doing. Using paint, Alex has found a creative way to inform and entertain Tanzanians through a pandemic that forces them to be apart. Each day, he transforms into Tanzania Joker, finds an open area, and starts using the craft he loves to help others make it through this dark time. Becca, Alex's best friend, has a tedious task of painting him each time he goes out. He believes in the impact that they're making, but it's not an easy task.
We decide how we want it to look, how should the lungs be, how are they positioned. You end up using a lot of time, sometimes 3 or 4 hours.
The government has taken measures to combat the spread of the coronavirus. Among them, it has closed all educational institutions for a period of 30 days. It has also banned all public gatherings as well as any sports activities. Alex says he will keep on doing his part but calls for support.
I wish that when I am educating citizens, they can each get sanitizers or masks. I know they get educated through me. but I wish I had a big speaker so I can talk to people without them getting close to me. Everyone should be fair.
Through him continuing to express himself, Alex is becoming a real-life hero. He's an inspiration to his people as he motivates them to change behavior so as to save lives. Daniel Kijo, CGTN, Dar es Salaam.
Let's now take a look at your sports news. Here's what's ahead. We bring you the inspirational story of Lowell Barnes from living in the streets to playing professional golf in the South African Senior Tour.